So let me introduce you our first speaker for the day. So we have Dr. Noliza Muksan. Dr. Noliza is a family medicine specialist working in Kota Damansara Klinik Kesihatan. So she'll be kicking off the session with this CPG module this afternoon, where she's going to be highlighting the pathogenesis and what are the risk factors for acne. So without further ado, let me invite Dr. Lisa to kick off the session with her topic. Okay, so Dr. Lisa, let me pass over to you.
Thank you, Dr. Azura. Okay, with the first topic, which is introduction, risk, and aggravating factors. Okay, for the learning objectives of for the first topic is to understand the risk factors for acne vulgaris and to identify the aggravating factors of acne vulgaris. As for introduction, acne vulgaris is a common disease of the pilosebaceous unit. It affects adolescent and young adults. Commonly affected areas are the face and trunk. It is not just a cosmetic problem. It is a quite common misconception about acne vulgaris among our public. They thought that it can be self-limiting without any treatment. However, it adversely affects the patient's social life, self-esteem, and body image. If left untreated, it can cause scarring in some patients and contribute to significant psychological distress, such like depression and also anxiety. Okay, for the epidemiology, from the Global Burden of Disease Study 2019, it was noted that was highest in the high socio-demographic index region across all years for 10 years. It was common in women, about 1.3 times higher than in a man. And for the adolescent age 10 to 19, has a rate of acne vulgaris, which is highest and later drop sharply after the age of 20s. Okay, there is a wide variation in the prevalence of acne vulgaris among various countries. Example, in Malaysia, our prevalence is about 60.7 to 68.1% in a group of 13 to 17 years old secondary school students and also university students. The prevalence in Singapore is higher, which is 88 to up even 95% among 13 to 90 years old and secondary school students. Similarly, in Sri Lanka, the prevalence is about 91% among females aged 15 to 16 years old. In China, the prevalence is about 51% to 63% in different population age group, whereas in South Korea, the prevalence is low, which is about 36.2% among 7 to 12 years old. Okay, now we go to the risk factors. A number of risk factors and also aggravating factors for acne vulgaris have been described in the literature. It's very important for us to identify the risk factors in terms of prevention measures, to have an early detection, to get a treatment plan, to have a good treatment plan, and hence have to improve the quality of life. Now we go to the first risk factor, age. It is found that those who age of 15 to 18 years old has increased risk of getting acne. Those aged 7 to 18 years old has increased risk of acne severity. For gender, our local study showed that males are more likely to develop acne. However, another study in Kuwait found females are more likely to have acne compared with males. Those females with personal history of acne during their adolescent period is associated with adult female acne. How about the family history? Those who has a significant positive family history, either in their twins, mother, first-degree relatives, and also multiple family members, father, and also both parents, was associated with acne vulgaris among adolescent and young adults. However, family history was not found to be an aggravating factor for acne severity. About the BMI. Obesity, as you all know, obesity is closely related to hyperandrogenism. Hence, individuals with high BMI are at risk of developing acne vulgaris. Overweight and obese teenagers were more likely to have acne vulgaris. Diet. Those who consume diet with glycemic load of 175 and above was 25 times higher in getting acne. How about dairy products? Milk consumption was associated with acne occurrence. However, no association between consumption of low-fat milk and acne vulgaris. And there was also no association with acne vulgaris for yogurt and cheese. Chocolate and ice cream. How about chocolate and ice cream? One study showed chocolate intake resulted in occurrence of acne, while the other study did not. Similarly, with consumption of ice cream. One study said yes, another study said did not. Okay, now we come to the sweetened beverages and food. Sweetened beverages, sweetened tea, fruit-flavored drinks was associated with moderate to severe acne vulgaris. Frequent eating of pastries and cakes was also associated with increased risk of acne vulgaris. It showed that there is a significant association between current acne and consumption with fatty or sugar products and also sugary beverages. Unhealthy fat intake and also frequent consumption of sausages and burgers in adolescents has shown that increased risk of acne vulgaris. However, our local study showed no association between consumption of chips, fried food, potato chips, and acne vulgaris. How about nuts? So far in the literature search showed that no association with acne vulgaris. Fiber. Lack of fruits and vegetables is marginally related with increased risk of acne. Similarly, with fish, lack of fresh fish intake was associated with acne vulgaris. Okay. For being an office worker, no previous pregnancies and high or very high level of reported psychological stress has been associated with adult female acne. Practicing of face washing 3 times or more in a day was associated with decreased risk of acne vulgaris. Living in urban area was associated with decreased risk of acne vulgaris. How about smoking and alcohol consumption? So far, there are lack of retrieved evidence and to state smoking or alcohol causing acne. Other factors such as hirsutism associated with adult female acne. All skin type was significantly associated with acne severity. So my last slide on take-home message. Important risk factors for acne vulgaris are adolescent, age of 15 to 18 years, male gender, and strong family history. Aggravating factors for acne vulgaris include high glycemic load value diet, sweetened beverages, and also unhealthy fat intake. In conclusion, healthy lifestyle, which includes healthy eating, is advised as part of the management in acne vulgaris. You may refer to our CPG Appendix 3 to further view on list of food based on glycemic index. With that, thank you.
Thank you very much, Dr. Liza, for highlighting what are the common risk factors and the aggravating factors associated with acne. So I hope it's clear now what we can advise our patient. They always ask us what food to eat, what to avoid, and whether any particular food can aggravate acne. So now we can tell them, yes, milk consumption, any sweetened or fattening food, that can actually aggravate acne.